When an oral appliance therapy for the treatment of sleep apnea is initiated, it is common for the patient to experience muscular discomfort in the morning during the first week of use. The discomfort is the result of the jaw being retained in a fixed position for the entire night. The muscular soreness occurs with all oral appliances that advance the jaw and feels similar to what happens after excessive exercise. One way to reduce the discomfort is to take an over-the-counter anti-inflammatory medication prior to going to sleep. A recommended option is naproxen or naproxen sodium, which is marketed under the trade name Aleve. Many ApneaGuard providers initiate therapy at 1 millimeter less than the optimal setting during the first week of use to reduce the severity of muscular discomfort. This video explains how to adjust the ApneaGuard to the optimal setting when you are recommended to do so. Wearing the ApneaGuard at the optimal setting provides you the maximum treatment benefit while you adapt to the therapy and prepare for your custom oral appliance. When the ApneaGuard is fitted, the neutral and maximum jaw positions are used to determine the optimal or 70% setting. These three measurements are written on the ApneaGuard handle for a reference. The ApneaGuard is adjusted by affixing the lock pointed to the left for odd-numbered settings and to the right for even-number settings. Begin by removing the lock cover. Slip your index finger under the lock and pull up. To advance the setting 1 millimeter, rotate the lock so that the arrow points to the opposite direction. The arrow on the lock should now be facing the opposite side. Next, slide the upper tray along the lower tray until the target 70% setting is readable. For example, when adjusting to the setting 13 to the left and fully readable, setting 14 to the right is partially covered and not fully readable. Press firmly to hold the upper and lower tray in that position. Now align the locking pins with the two holes in the upper tray. The pins fit into the holes to the right, with the arrows on the lock pointing left for odd number settings. For even number settings, they'll fit into the holes to the left with the arrow pointing to the right. Press down on the lock until the pins snap into place. Once adjusted, the 70% setting number will be readable at the bottom of the lock to the left for odd number settings or right for even number settings. Some patients will have an optimal setting that includes a half millimeter increment. In these cases, clinicians typically initiate therapy 1.5 millimeters less than the optimal setting. For example, if the optimal setting is 12.5, therapy will be initiated at the setting 11. And the ApneaGuard setting will be 12 after you make the 1 millimeter advancement. Slide the blue lock cover over the handle to prevent the lock from disengaging. You've now advanced your ApneaGuard 1 millimeter to the optimal setting. The advancement may cause muscular discomfort for a night or two, similar to when you first started wearing the ApneaGuard. If the discomfort continues for more than 2 nights, adjust the setting back to the original setting.